Hi, everybody. I'm Dr. Brian Ardis, and this is the Dr. Ardis Show. And we are so excited and thrilled for you to be joining us today. I hope this presentation is enlightening to you, inspiring to you, and I hope it provides thousands and eventually, I hope, millions of people hope in a condition which affects the physical and emotional aspect of so many people's lives. We're going to be talking about a very specific skin condition that literally mortifies people who don't have it. It bothers people who do have it emotionally and physically, and it's called psoriasis. So psoriasis is what we're going to be discussing today. What are the natural cures for that? And this entire presentation, how to psoriasis naturally, which you were told by every rheumatologist and dermatologist, there is no known cure for this. You're about to learn that is not true. And we're going to teach you many individual minerals and plant extracts that are proven to actually reverse, improve, or even psoriasis. So this actual entire show is being brought to you by our product called Biodefense. And you're going to learn in this presentation why this is numero uno. Anybody dealing with topical issues like shingles, measles, herpes, psoriasis, eczema, cradle crap or cradle cap on babies' heads and infants' heads, dandruff. If you've got issues skin related, if you're not on Biodefense, taking this orally twice a day, one dropper full in empty vegetable capsules. I do not recommend anybody take this orally, even though some people enjoy doing that. It tastes like soap. It's a very intense, not pleasant taste from the plant extracts we compiled into this one very powerful, very unique herbal extract. We're going to go through each of the ingredients in here and why this should be your first go-to with anybody suffering from psoriasis or arthritis related to psoriasis. It's called psoriatic arthritis. So anybody you know who's dealing with an autoimmune skin condition or a reoccurring skin issue, it doesn't matter. They should be on Biodefense first. And yes, they should be using this topically and orally. Orally is 2 to 3 capsules full a day, taken orally, morning, afternoon, and evening if you want to, or at least morning and evening. And then I recommend putting this on Q-tips or cotton swabs and putting it on topically on the actual psoriatic rashes or eczema or blisters or infections, like you're told herpes and shingles are. So you can treat them topically, you can treat them orally. We're going to start with Biodefenses, who's sponsoring this entire presentation. It is not the only thing we recommend. It is numero uno, what everybody needs to do. And we have heard some of the most incredible, fascinating testimonials of people clearing up their skin conditions and rashes they've had for years after just a few days or weeks of just using our Biodefense. Now, if you remember, the reason why we created that product was to actually wipe out the E. coli, enterobacter, bacteria, and yeast that are found in the bowels of people who are, and then they're shedding on people, those who are not vaccinated, those who are around those that we're actually getting the problems of shed onto them through the vector of bacteria and yeast that is completely wiped out by the all-natural ingredients in our Biodefense. So that was to preserve the lives of people who didn't want to suffer being around those who got the vaccine. Then it was to help those stop the suffering and lingering worsening symptoms related to the COVID. That's why we created Biodefense. It just so happens that along the way, when they introduced talks of the bird flu coming out when Donald Trump took office, the first ingredient we have in our product is black cumin seed oil. It's a published cure for the bird flu. So that was very exciting. Now you've got the same product. You just need it in your medicine cabinet. Everybody at home needs Biodefense, one bottle in their homes, I believe. Now you're about to learn how this has been proven very effective at curing almost every dermatological scenario or syndrome published by medicine. So ask your dermatologist if Biodefense is right for you and the ingredients that are in it. If you have psoriasis, eczema, shingles, measles, it doesn't matter. You should be on this at a bare minimum. And yes, there is a recommended dose of treatment. I just gave it to you. 1 in the morning, 1 in the evening, full capsule full, which is 1 dropper full, twice or 3 times a day. For prevention and maintenance, I recommend at least 1 capsule every day full of Biodefense. And you just do that every single day. It's what I do. It's what my wife does to keep away any candida or yeast or bacteria that could create problems in her, which I don't want, she doesn't want, and none of us want. So that's why we have Biodefense. All right, so let's dive into how you cure psoriasis naturally, because it is not the only thing. I just want to make sure you know my why to why it is we created and formulated Biodefense. It is an incredible combination of plant extracts designed by God. We just compiled them together, maximizing their healing effects for all things dermatological, meaning your skin issues, and gut issues. So here we go. We're going to dive into the presentation. This is How to Heal Psoriasis Naturally by yours truly, Dr. Brian Ardis. All right, let's dive into this. You can scan the QR code here in order to get access and put in your email to where we can notify you weekly on our unique once-a-week podcasts. If you want to be involved and included and subscribe to our email list for our promotional products, be it a book, be it our formulas, we actually have 5 unique formulas that we're releasing this year. We've already turned over to contract manufacturers to start developing and sourcing the ingredients for 5 products that will handle 5 unique health conditions. And we're very thrilled to introduce those to you. If you'd like to be notified of when those are and what those products are, scan the QR code, put in your email, and we will notify you for free when our podcasts are coming up and narrations are coming up and when our new formulas are being released and when they'll be ready. All right, so let's dive into psoriasis. This is from the Cleveland Clinic. So we want to make sure that you have a clear definition of what psoriasis is. Remember, the same information we're about to give you applies to all skin conditions: acne, eczema, psoriasis, doesn't matter. Make sure you share this presentation with everybody you know and love who has a reoccurring chronic skin condition. All right, so psoriasis is an autoimmune skin condition that causes itchiness and discomfort. Plaque psoriasis, per the Cleveland Clinic, is the most common type. It causes thick, scaly areas of skin. While there isn't a cure, they state, psoriasis treatment can help manage symptoms. That's the Cleveland Clinic. So let's now go to the foundation on psoriasis. About psoriasis, this is an overview of what they're going to teach us. The symptoms of psoriasis are this. I'm going to have to blow this up here so I can see the whole screen. It's a little bit small on my screen. So you've got red, brown, or purple patches of skin, patches of thick, raised skin or plaques, itching, irritation, burning or stinging, pustules or blisters, dry skin that may crack or bleed, changes to nails, and flaking of dead skin. Those are how they describe the symptoms of psoriasis at psoriasis.org. Now, if you go to WebMD, you'll see Who Gets Psoriasis as an article. Underneath this article, they describe to you what's the disease process called epidemiology. What is the disease process of psoriasis? This is how many people it affects. Psoriasis affects an estimated 7.5 million to 8 million people in the United States and about 125 million worldwide. Your immune system and your genes both play a role in causing it. Here's a closer look, they say, on who tends to get this condition. What are the best treatments for you with those suffering with psoriasis? This is per goodrx.com. And this is what they highlight. The prescription topical treatments for psoriasis are these: corticosteroids. You'll see some of their types there. You'll see Clobex and Trianex are the brand names of the generic drugs called trimethicillone, and then clobetasol, generic names. Remember, I have fun with drug names. They should make them up. I have fun trying to pronounce them. Then you have vitamin D analogs like retinol and not retinol. Retinol is a vitamin A analog. You've got calcitriol, calcipotriene. These are both generic names of vitamin D type drugs for psoriasis. Then you have calcineurin inhibitors, and you'll see these are off-label treatments for psoriasis. Protopic is a brand name. Elidel is a brand name. And then keratolytics. These are drugs that stop the keratone development. And these would be your retinoid drugs, vitamin A-based drugs that include retinoid called tazarotene or Tazarac. And then a prescription dose of salicylic acid. That's in a lot of acne drugs. These are your typical drugs prescribed for psoriasis. Then there are some oral drugs prescribed for psoriasis. First one is methotrexate, which is actually a drug that is commonly prescribed to all people that are diagnosed with a rheumatoid arthritis or an autoimmune disease. Lots of people are put on methotrexate. Cyclosporin is another oral drug for psoriasis that is very commonly prescribed. Apremilast, Otezia is what its brand name is. And then Xeljanz. Many of you have seen the commercials for Xeljanz. That is another drug that is approved for psoriatic arthritis. And then you'll see Soriatane, which is another brand name drug, oral drug for psoriasis. There are also what are called biologics and biosimilar drugs. Biologics are those medications that target the immune system. That means they shut them off. They're used to treat more moderate to severe psoriasis and psoriatic arthritis. And then some biologics or biosimilars include these drugs you'll see below, which most of them end with the abbreviation MAB. MAB stands for monoclonal antibodies. And you'll see their names there. Humira is one of them. Humira is the second one listed there. Stelara is another monoclonal antibody. Illumia, Silic, and Remicade are other drug names for biologics used for psoriasis. What do these treatments really do? These prescription drugs offered to us by science. Here's methotrexate. You can see a picture in the top right-hand corner. I already mentioned that this is which it is. You'll see the brand names are highlighted top left. This is from drugs.com. Trexol, Zatmep, and Jalemvo are the brand names of methotrexate. Methotrexate, what is it? Interferes with the growth of certain cells of the body, especially cells that reproduce quickly, such as cancer cells, bone marrow cells, and skin cells. At the bottom, you will read, we'll go back. Methotrexate at the bottom is also used to treat severe psoriasis and rheumatoid arthritis in adults. We want to show you the black box warning. We were all shocked here when Braden, my son, was putting together some of this research. He was like, Dad, did you know how long, it's pages long, the FDA black box warning is for methotrexate? He goes, I can't include all of it inside these slides. And I said, no worries. Yes, I do know. Let's just highlight some of the majority of them. But you would be shocked at how many millions of Americans are being prescribed methotrexate, which is a known poison. Its list of horrible side effects. In fact, let's read at the top right. Out of the FDA black box warning package insert, this is what it reads. Methotrexate can cause embryo fatal toxicity, including fetal. Well, just so you know, if you're growing a baby in the womb and you swallowed methotrexate, it's known to kill a baby. Well, okay, if that's the first warning, what does it do to the big babies called adults that take methotrexate? Let's keep reading from the black box warning. You will read the next highlighted underlined statement is serious adverse reactions, including death, have been reported with methotrexate. Not just in babies. These are the big babies, the adults. Ask your doctor when they prescribe methotrexate if it's right for you. Closely monitor, they state, the FDA does, for infections and adverse reactions of the bone marrow, gastrointestinal tract, liver, lungs, skin, and kidneys. Then they continue with these warnings. This is from drugs.com, not chiropractic.com. I'm giving you a real website called drugs.com. Methotrexate can cause serious or fatal side effects. Call your doctor at once if you have any of these following symptoms. This is a warning for all of you. If you know anybody with psoriasis, they're probably on this drug. Did you know that methotrexate is known to cause low blood cell counts, which will lead to fever, chills, tiredness, mouth sores, skin sores, easy bruising, unusual bleeding, pale skin, cold hands and feet, feeling lightheaded or shortness of breath? Let's stick with the skin sores. Could you imagine being diagnosed with psoriasis, knowing you have this really awful scenario occurring on the outside of your body? How would you like to be prescribed a drug that causes skin sores, mouth sores, to add to your psoriasis sores and scales? How about kidney problems? They state little or no urination coming out of you, swelling in your feet or ankles can be a serious side effect, a fatal side effect of methotrexate. What about liver problems? They state that when you take methotrexate, swelling around your midsection, right-sided upper stomach pain, nausea, loss of appetite, dark urine, jaundice, yellowing of your skin or eyes is a serious side effect, meaning you're having liver failure. What about nerve problems? They're telling you serious, even fatal side effects of methotrexate include confusion, weakness, drowsiness, coordination problems, feeling irritable, headaches, neck stiffness, vision problems, loss of movement in any part of your body, and seizures. So not only can you have plaques ruining your complexion, you can also add seizures, convulsions, inability to move body parts. What about tumor cell breakdown? You can have tiredness, weakness, muscle cramps, nausea, vomiting, diarrhea, fast or slow heart rate, tingling in your hands and feet or around your mouth are some of the published side effects of methotrexate. What about cardiovascular side effects? Did you know up to 1% of everybody with this drug will experience pericarditis, pericardial tamponade, changes in their heart rhythms? What about skin reactions? Under dermatologic, up to 10% of all people will experience dermatitis rashes. You're looking at it on the screen. Let's add that to psoriasis scales. Did you know 10% will experience nausea and vomiting? From methotrexate, 1 in 10 of you will start vomiting as a result of a side effect of the poisoning effect of methotrexate. What about genitourinary side effects? Up to 1% of you will experience vaginal inflammation and ulcers. On top of psoriasis plaques, ask your doctor if vaginal ulcers are right for you. What about respiratory? That's up to 10% of you will experience pneumonitis, like pneumonia, in 10% of you. This is crazy. What about the next drug called tofacitinib? Xeljanz. You've all seen the commercials for this psoriasis drug prescribed. What about its FDA black box warning? Did you know there's serious infections? Patients treated with this drug are at an increased risk for developing serious infections that may lead to hospitalization or death. When your doctor prescribes Xeljanz for psoriasis, ask them if serious infections that can lead to hospitalization and death are right for you. What about cardiovascular risk? Did you know that hypertension, high blood pressure, in 1 out of 10 will develop in those taking Xeljanz? That's in just the research study group. Did you know that up to 10% of you will also, 1 in 10, develop rashes and acne? I'm not sure adding acne and more rashes to psoriatic rashes is a good idea, but maybe your doctor thinks that's a good idea. Did you know up to 10% of you will develop diarrhea, abdominal pain, vomiting, gastritis, nausea, constipation as a side effect of Xeljanz? How about 10% of you will have liver failure denoted by increased ALT, increased AST, and increased GGT on your blood panel? Ask your doctor if liver toxicity is right for you. 1 in 10 will develop it. How about musculoskeletal reactions? How many of you knew that Xeljanz, being prescribed for psoriatic arthritis and psoriasis, 1 in 10 will develop rheumatoid arthritis as a side effect to Xeljanz? 1 in 10 will develop rheumatoid arthritis from the drug. Well, I don't know about you, but if you're going to develop a threat and risk of psoriatic arthritis, do you think throwing rheumatoid arthritis on top of that's a good idea? Ask your doctor that's prescribing Xeljanz to you for psoriasis and psoriatic arthritis. Ask them if rheumatoid arthritis is right for you, because 1 in 10 of you will develop it. Oh, what's the other risk? 1 in 10 will develop Epstein-Barr virus-associated lymphoproliferative disorder. Swollen lymph nodes. How about that? Oh, look at the bottom. For cancer. After the research trials were done with Xeljanz, human trials, they followed up these people after the trial was over, and there was an increased reporting in skin. Ask your doctor if all these are right for you when they prescribe Xeljanz to you. 49.4% of all people who are diagnosed with psoriasis and put on Xeljanz will, 49% of you, that's 1 in 2. 1 in 2 of all of you will develop a serious infection because of the drug called Xeljanz. Another 20% of you, 18.2% of you, will develop a very common respiratory infection called nasopharyngitis. Ask your doctors if respiratory infections are right for you when they prescribe Xeljanz, because 50% of you will develop infections related to the drug itself, and another 20% of you will develop a nasopharynx infection. And another 10% of you will develop urinary tract infections. Sounds amazing. How about Humira? Here's Humira, which everybody's watching drug commercials on. It's one of the most prescribed drugs in the whole world. Humira is used to treat many inflammatory conditions in adults, such as rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, plaque psoriasis, and a skin condition called hidradenitis suppurativa. All right, so let's look at its black box warning for Humira. Increased risk of developing serious infections that may lead to hospitalization or has occurred with Humira. Ask your doctor if hospitalization and death for you when they prescribe Humira. They also write here in the black box warning that fungal infections, including histoplasmosis, coccidioidomyosis, candidiasis, aspergillosis, blastomycosis, and pneumocytosis. Ask your doctor if those are right for you. because these are all published side effects of taking Humira. Now, 1 in 10 will develop hypertension, high blood pressure. And then there is 1% of you, 1 in 100, will develop congestive heart failure from that drug. Isn't that amazing? How about dermatological skin conditions? Those of you with psoriasis being told you need Humira, did you know that 12% of you will develop additional rashes, as pictured on the right? And those rashes are created by the drug. I'm not sure adding more rashes to a rash condition is better, but up to 10% of you, they list from drugs.com, will result in dermatitis and eczema and pruritus, which are pictured on the right. Not really sure that makes it better. If you keep going, look at the next three, you'll see not only is eczema and pruritus underlined, 1 in 10 will develop that. Notice they wrote psoriasis occurs in 1 in 10 people taking it. So for every 10 people being prescribed Humira for psoriasis, Humira, just so y'all know, increases the amount of psoriasis plaques you make. Ask your doctor if more psoriasis is better for you when they recommend Humira. Also, look, this says herpes zoster is the last one. Up to 10% of you will develop herpes zoster. Y'all know what that is? That's shingles. Ask your doctor, all of you being prescribed Humira, if shingles is right for you, because I hear that sucks for a lot of people. Up to 10% of people taking Humira will develop abdominal pain, diarrhea, stomatitis, and mouth ulcers. 10% of you will develop urinary tract infections. Another 10% of you on Humira will develop lymphopenia, agranulocytitis, granulocytopenia. These are all white blood cell issues related to the liver. Local, 10% or more injection pain from Humira. Metabolic, hypercholesterol, high levels of cholesterol levels will increase due to Humira. Another 12% will develop headaches. That is published. If you're just taking Humira, it'll create 1 in 10 people to have headaches. 17% of everybody on Humira develops upper respiratory infections from Humira. Another 10% develop sinusitis, sinus infections. Another 10% of you will develop pneumonia, pharyngitis, and nasopharyngitis. Psychiatric, up to 10% of you on Humira will develop depression, anxiety, insomnia, and mood alterations. Ask your doctor if psychiatric mood disorders are right for you when they prescribe Humira. And serious infections that result in hospitalization and death is the first black box warning. Now it's time to dive in here. You ready for some natural remedies for psoriasis, which every medical specialist and website says there is no cure for. Sorry, there are many for psoriasis, and we're about to dive into those. Ready? This is going to be very exciting. This is when we started talking about biodefense, everybody, at the beginning of the show. First ingredient in here is black cumin seed oil. This is a case report of a psoriatic arthritis patient achieving remission of their psoriatic arthritis and psoriasis plaques by taking black cumin seed oil, using it topically and orally. So I'd like to share with you this report of how somebody keeps themselves of psoriasis after being diagnosed with an uncurable disease called psoriasis. Let's read together. Psoriatic arthritis patient. This one is one of many of psoriasis and will develop in 20 to 30% of patients with psoriasis, psoriatic arthritis. Extracts from Nigella sativa, which is black cumin seed oil, the first ingredient in our biodefense product, also known as black seed oil, has been found to have anti-proliferative, it stops growing of extra cells, anti-osteoporotic, reverses osteoporosis, anti-inflammatory, and anti-diabetic effects in many studies. That's what biodefense does, black cumin seed oil. The use of Nigella sativa systematically for the treatment of psoriasis or psoriatic arthritis has not been investigated, they write, or reported in the literature. We described the case of a patient with psoriatic arthritis, refractory to both conventional treatments and biological therapy, who achieved minimal disease activity states when he took oral black cumin seed oil on his own. So he just swallowed black cumin seed oil orally by himself. This is a very cool actual case study, and I would like for all of you to listen, because it's very important you understand what this guy did. This guy was diagnosed with psoriatic arthritis, put on drugs for them, and they didn't go away, his psoriatic plaques. They just stayed the same for years. This patient is a 56-year-old man who at the age of 31 was diagnosed with polyarthritis disease and severe skin plaque psoriasis. He had no uveitis and no gastrointestinal diseases, they reported. Indomethacin, which is a drug at 150 milligrams per day, along with methotrexate, 25 milligrams weekly, had no improvement. Followed by seleccoxibib, 400 milligrams per day, another drug, after which he was prescribed elanercept, 50 milligrams weekly in 2003. He continued these treatments until 2011. That's 8 years later, when he chose to stop them because the drugs weren't working. That's a list of 4 different drugs prescribed to him for psoriasis and psoriatic arthritis that provided no benefit for 8 years. How many people are struggling with psoriasis, still have psoriasis, and are taking each of these drugs? He started applying Nigella sativa oil, black cumin seed oil, cold pressed, 100% oil marketed over the counter topically to the inguinal area where he had severe skin plaques. He noticed marked improvement. The skin cleared within a week of treatment. Within 1 week, people, 1 week. 8 years of drugs didn't fix psoriatic arthritis or his plaques. He started applying this topically to his inguinal area where he had psoriatic plaques. And within 1 week, it cleared up. Isn't that amazing? In light of these results, he decided to start taking it orally. He started swallowing it. And around 2 teaspoons is all he took, which equaled about 10 grams of this extract, which is very important to note. This is what they did. 2 teaspoons every single day, which contain about 400 micrograms of this healing component called thymoquinone. After only 3 days of oral treatment, he reported marked improvement in all of his joint pain from psoriatic arthritis. 3 days of drinking it. After 8 years of swallowing prescription drugs, 3 days of Nigella sativa oil swallowed cleared up all his psoriatic arthritis that he had for years. Ask your doctor if biodefense is right for you, because I'm telling you it is, and I am a doctor. I'm Dr. Ardis. But ask your doctor if biodefense is right for you, and share with them this research studies. It's amazing. He also improved range of motion of bilateral hands and knees. Skin examination did not reveal any active psoriatic lesions. So he tried it topically for 1 week, tried it orally for 3 days, and all of his psoriatic lesions cleared up on his skin topically. No more psoriasis and no more psoriatic arthritic pain. In fact, they said of all of his joints that had psoriatic arthritic pain, they could only find slight amount of edema after day 3 of swallowing black cumin seed oil. After suffering with psoriatic arthritis and psoriasis for years, over a decade, and taking drugs for them. God's pharmacy is greater than man's pharmacy. The patient's disease activity index for psoriatic arthritis while taking the drugs was 25, indicating moderate disease activity. This score went down to 4 after using Nigella sativa oil topically for 1 week and swallowing it orally for 3 days. Isn't that amazing? Nigella sativa oil. Black seed oil extracts, inhibitory effect on skin keratinocytes, which develop the scale plaques of psoriasis, inflammation in albino rats with the drug-induced psoriasis-like lesions was demonstrated by the researcher named Okasha. Black seed extract showed extreme treatment success defined by PASA psoriatic arthritis scale index reduction of at least 75% in 10 of the 12 patients that were included in this study. Tell everybody at home about black cumin seed oil and our biodefense product. You should be doing 2 to 3 capsules every day. The second ingredient inside of our biodefense is this substance called peppermint essential oil. You might want to know if this is right for you because it's the second ingredient in our biodefense, and it absolutely has anti-inflammatory reactions in the bowel, leading to improvements in skin conditions. You will see here what is the benefit. In the middle, you see peppermint essential oil. You see all of its benefits published when it's taken orally or topically in a human. It has antibiotic benefits. It has anti-benefits. It has antioxidant benefits, anti-fatigue benefits. It protects the nervous system, and it's anti-inflammatory. Well, psoriasis is an autoimmune inflammatory disease. All right, so at the bottom, you're going to read application of gastrointestinal diseases. Peppermint essential oil extract causes significant opening of the pyloric ring, the sphincter at the bottom of your stomach, and affects the transporting activity of enterocytes in the intestinal lumen by inhibiting glucose uptake. Besides that, peppermint essential oil plays a role in relaxing the smooth muscle of the gastrointestinal tract, which is helpful for the treatment of irritable bowel syndrome and celiac disease and all intestinal bowel disorders that lead to autoimmune skin conditions. Peppermint oil can relieve symptoms of indigestion. Peppermint essential oil extract relaxes the lower esophageal sphincter and smooth muscle when applied to muscle strips in a lab. The T hysteresis was sharply reduced in healthy volunteers after ingestion of peppermint oil, indicating that peppermint essential oil can enhance gastric emptying, and the beta constant was also significantly decreased. And I want to say here, I know it sounds like a bunch of scientific terms. How many of you have heard that people on Ozempic and Wegovy have paralyzed stomachs and are now vomiting for years afterwards? Peppermint essential oil, you are learning, relaxes the lower esophageal sphincter and smooth muscle and helps to improve the gastric emptying, which is what Ozempic paralyzes. So you might want to tell people about biodefense who are struggling with gastroparesis. They should be on that every single day. Also, the last statement highlighted in the first paragraph, peppermint essential oil has antibacterial, anti-inflammatory, antioxidant. It modulates the immune system and has anesthetic activities, all of which may benefit the treatment of irritable bowel syndrome. Peppermint essential oil can relieve spasms in the intestinal wall, allowing for better visualization of the bowel with colonoscopy. And finally, topical administrations of peppermint essential oil as aromatherapy can eliminate fever, relieve nausea and vomiting, and improve digestion. One of the intractable dermatoses is the pregnancy-specific skin condition called PUPPP. Pruritic, urticarial papules and plaques of pregnancy. Herpes, gestationitis, and pruritic folliculitis of pregnancy with itch as the most dominant symptom. It is well established that menthol in peppermint essential oil can weaken itching caused by histamine through cooling the skin by activating alpha delta fibers and K kappa opioid receptors. I want to emphasize here, it cools the skin, peppermint essential oil, which is something that all psoriatic arthritis and psoriatic plaque patients and sufferers have, that reddening inflammatory reaction. Second ingredient in our biodefense is peppermint essential oil extract for this exact reason. Extensive data also shows that peppermint essential oil as a dietary supplement, which it is in the biodefense product, or nutraceutical, is beneficial for the management of functional gastrointestinal disorders and IBS. And I'm about to do an interview about reversing celiac disease specifically, and we're going to be talking about biodefense and peppermint oil once again. Piperine ameliorates psoriatic skin inflammation by inhibiting the phosphorylation of STAT3, an inflammatory marker in your blood. Biodefense has piperine in it, as one of its ingredients, one of its main 4 ingredients, actually. Piperine, let's read what it does, because it's in biodefense and it is published to improve psoriatic lesions, to reverse psoriasis. To explore the role of piperine in the treatment of psoriasis, the effect of piperine on M5 cells induced psoriasis like dermatitis was investigated. The results showed that piperine inhibited HA-CAT cell proliferation in a dose and time-dependent manner, meaning as they added piperine, they saw a reduction in the cells that lead to psoriasis plaques. The more they gave, the less psoriasis plaques developed. Piperine promoted the expression of cleaved PRP, an apoptotic molecule. Apoptotic means it kills those cells. We're killing the psoriatic plaque cells in a dose and time-dependent manner. Chemokines, it also reversed in a dose-dependent manner. These are inflammatory cells. And you can see here on the skin of these animals that they were measuring dermatitis and psoriasis plaques. You see at the bottom, piperine added to the skin reduced the psoriatic proliferation better than all the other products in a dose and time-dependent manner. This is the fancy scientific terms of how piperine works to reduce psoriatic-like dermatitis, which you'll see is the right in the middle of the paragraph. The results showed that piperine inhibited the phosphorylation of STAT3 in a dose and time-dependent manner in the M5-induced psoriasis-like dermatitis animals. So if you want to reverse psoriasis, you have to use piperine. Topical creams of piperine-loaded lipid nanocarriers showed good potential for the treatment of atopic dermatitis, which would benefit your psoriasis. I recommend everybody put Biodefense topically on your psoriatic lesions, your jock itch, your rash, you name it, your eczema, your shingles. You should be putting it on there. Piperine is highly feasible as an external preparation to treat skin conditions, they say, owing to its anti-inflammatory, antioxidant, and its immune-modulating actions. Piperine may be an effective therapeutic candidate for the treatment of UV-induced skin inflammation, that's sunburns, as well as other inflammatory skin diseases, including psoriasis. In addition, piperine may postpone skin aging because it's an antioxidant and has anti-aging effects. Just an added bonus. Less psoriasis, plaques, and scales, and you're reversing your aging. Now let's look at vitamin D. We just highlighted several ingredients in our Biodefense, which is why it's the first product I recommend for all people, internally and externally, to fix the bowel, to fix the skin. Psoriasis is a gut problem. So you have to take Biodefense to clear the gut of the bugs and bacteria causing the psoriasis in your skin. You got to clear it from the gut, clear it from the body topically. You can use Biodefense topically and orally, and you should. And then you should be sharing your testimonials with us. Take pictures of your rashes, your shingles, your psoriasis scaling plaques. Take pictures before, and then do a picture each week of using our Biodefense. And then we would love to send you some free product, some free rewards for sharing your testimonials with the world, which will also instill hope and confidence and excitement in them that they could experience clear skin like you did with your Biodefense experiment. And remember, it comes with a 90-day money-back guarantee. But let's dive in now into vitamin D. This is the next product. There is a direct correlation between vitamin D levels in the blood and psoriasis. So in every single case, if they've taken a psoriasis patient, took their blood work, they all have low vitamin D levels. That is something they all have in common. So this is just recognizing vitamin D levels in psoriasis. And this is what they discovered. There is a significant direct effect of blood vitamin D levels on developing psoriasis. Each one standard deviation decrease in blood D levels is associated with an increase of 5% increased risk of psoriasis. For every 1 unit lower of vitamin D in your blood level, in your blood results, a 5% increase in your risk of developing psoriasis occurs for every 1 unit of vitamin D going down from normal. There is a significant causal effect of lower vitamin D levels on increasing the risk of psoriasis. I'm only reading the highlighted statements here. Analysis suggested that the genetically predicted risk of atopic dermatitis was significantly associated with increased levels of blood vitamin D levels. Now let's get into the discussion. In this study, we carried out a bidirectional MR analysis and tested causal relationships between circulating vitamin D levels and the risk of 3 common skin inflammation diseases, which are psoriasis, atopic dermatitis, and vitiligo. We identified a significant causal effect of elevated blood D levels with a decreasing risk of developing psoriasis and suggested that the incidence of atopic dermatitis raised blood vitamin D levels. So for psoriasis, they have low levels of vitamin D, and atopic dermatitis, they have raising vitamin D levels. Early epidemiological studies have shown lower vitamin D levels in patients with psoriasis than in healthy controls. Administering vitamin D supplementation led to reduced mortality in patients with psoriasis. And topical vitamin D analogs or drugs demonstrated effectiveness in treating psoriasis. You learned about COVID-19 and vitamin D levels. The higher the vitamin D levels, the lower your risk for severe infections or disease processes with being hospitalized. You're learning here, the more vitamin D in the blood, you lower your risk for developing psoriasis plaques. We identified low levels of vitamin D increase the risk of psoriasis. Vitamin D receptors are widely present in keratinocytes, which develop psoriatic plaques, dendritic cells, macrophages, and T cells. The active form of vitamin D interacts with its receptors within these immune cells, which as a result, the vitamin D promotes antibacterial or antiviral innate responses, and it attenuates adaptive immunity to help reverse autoimmune diseases. Vitamin D does. In psoriasis, abnormal vitamin D metabolism might play a role in activating T cells, called thymus cells, and regulating cytokine secretion, inflammatory markers. The blood levels of pro-inflammatory cytokines, such as IFN7, tumor necrotic factor alpha, interleukin 1b, interleukin 6, and interleukin 8, and interleukin 17, significantly decreased in patients with psoriasis after a 3-month administration of vitamin D. So, how long should you be supplementing vitamin D for with psoriasis? This research study was 3 months, and they see significant reduction in inflammatory markers in the blood that correlate to an autoimmune disease like psoriasis. These results together suggest the potential of vitamin D in reducing systemic inflammation in psoriatic patients. We confirmed the previous reported causal relationship between vitamin D levels and psoriasis. The vitamin D levels with an increased risk of psoriasis and consequence of increased vitamin D levels in atopic dermatitis for the first time. Also, they found that quercetin inhibits psoriasis plaques. This was done in a mouse model. They wanted this mouse model. So they investigated a mouse model for psoriasis induced by a drug called imiquimod. Imiquimod was employed to assess alterations in the skin lesions and their histopathological characteristics, how it changed over time. The mice in the model group exhibited characteristic alterations associated with psoriasis. They induced psoriasis. And what did they find? This study at the end shows that quercetin may play a therapeutic role in psoriasis and inhibit the signaling pathway which creates the scales in psoriatic plaques. Here you see, bottom right, QCl, QCM. This is quercetin being used, and you can see on the right just how powerful of a reducer quercetin was for the inflammation and scaling of psoriasis plaque lesions. Quercetin reduced psoriasis skin lesions. Then we looked into selenium. Selenium nanoparticles produce a beneficial effect in psoriasis by reducing epidermal skin cells, hypergrowth, and inflammation. Here they were able to demonstrate in the study that selenium taken in psoriatic animals, they were able to show that when they gave them selenium, not only did it reduce psoriatic plaques, it actually shrunk the spleen back down to a normal size. And what you're seeing here is an inflamed, large spleen in the first 2 animals. Then 3 and 4 animals, you'll see selenium nanoparticles at the top. You'll see the spleen was actually of a normal size, so it was reducing the toxicity of the drug-induced spleen enlargement created by the drug they used to create the psoriasis in this study. So it had a spleen protective thing or impact. The topical selenium neuroparticles gel treatment significantly reduced the epidermal growth rate and improved the epidermal structure to the nearly normal thickness of the spleen of these animals. It was also found a marked increase in the expression of these various cells that lead to plaque formation. They saw them downregulated by selenium nanoparticles. A marked downregulation in the expression of these proliferative markers was found with selenium treatment. And I'm just going to skip here to the end. In summary, our findings demonstrate that selenium nanoparticles primarily target keratinocytes responsible for the plaquing of psoriasis scales in vitro by inducing apoptosis, cell death, and thereby reducing the proliferation or growth of these scar-like scales. These demonstrate the effectiveness of selenium nanoparticles in eliminating and alleviating drug-induced acidosis and further abrogated or resolved scaling of plaque lesions in psoriasis growth. The last thing I'm going to show you is taurine. Now, taurine has been published and found to resolve and improve psoriatic plaques. I love taurine. I love talking about taurine. This is why we have taurine at the Dr. Ardis Show. Bromotaurine, a natural taurine oxidizing derivative produced by inflammatory cells. This substance, taurine, has anti-inflammatory properties, anti-proliferative, and antimicrobial properties. This evidence, they said, prompted them to use this taurine agent for treatment of therapy-refractory psoriasis. 2 pustular plaque psoriasis cases, unresponsive to normal drugs and local treatments, one with localized lesions and one with generalized lesions all over their body, were selected. Both applications primarily indicated a sufficient curative activity of 1% in the psoriasis lesions. Moreover, the taurine administration and a novel olive oil formulation cut in half the time needed for the taurine alone to cause the same regression of equivalent psoriasis plaque lesions in those patients. Taurine had a beneficial effect to actually shrink the plaque lesions of psoriasis. But when they added taurine with olive oil topically, it even had a greater reaction to shrink and resolve and regress the growth rate of plaque lesions. Importantly, all the adverse effects of taurine, itching and bleeding, could be minimized by the combination of olive oil added to it. For over a period of 2 to 7 weeks, they were able to completely resolve the plaque lesions in both patients. Of note, there was no relapse within 3 months of follow-up. Taurine with olive oil. How about that? Here's our biodefense. You'll see Nigella sativa oil and Mentha peppermint oil. Piperine is the 2 of the 3 first ingredients in our biodefense product, oral and topically for psoriasis every day. 3 to 6 months minimum. Preventative, do it every day, once a day. Vitamin D3. This is our vitamin D3 product at the Dr. Ardis Show. You see the amounts. That equals 5,000 IUs, by the way, our vitamin D3 capsules. Quercetin. We have 500 milligrams in 1 capsule. You can get that at the Dr. Ardis Show at Nature Wins. And then here is our selenium product with our selenomethionine ingredient, 200 micrograms per capsule, perfectly adequate enough. If you're doing selenium for psoriasis, I recommend doing 600 micrograms a day. That would be 3 capsules a day, along with your biodefense, taurine, your quercetin, and the other products we were mentioning here in this show, including vitamin D3. Once the psoriasis clears up, then I would go down to 1 capsule of selenium. Then you have taurine at 500 milligrams per capsule. I would just recommend the 1 capsule a day for taurine. This is, for all of you out there wondering if you should take this, I recommend this to all people. This is our full GI panel and bacterial swab test kit. If you go to the Dr. Ardis Show, go to Parasite Testament or Parasite Treatment Kit under Shop All. You can order this kit directly from Parasite Centers Incorporated. It's $286. There is a discount code for 10% off, or a coupon code. It's my last name, all capitals, ARDIS, all caps, the number 10, exclamation point, will save you 10% off the $284. I only show this because I recommend, if you have psoriasis, wouldn't you like to know what bacteria, yeast, or parasite you have in your body causing it? This test is a very simple, cheap way to figure out what you have and how much of that. And if you're going to follow the recommendations here for this psoriasis presentation, you just might want to know, did it clear up all of those infections in those 3 months you use those products? The only way you're going to know is if you do the stool sample test afterwards and see the before and after. I recommend everybody, if you're taking the stool sample test to see if you have any of these bugs creating your diseases or your symptoms, including psoriasis, follow our recommendations for 3 to 6 months minimum, and then redo this test to see, are all the bugs gone now? And if they're gone, you should have already seen a massive improvement in your skin, and your psoriasis should have cleared. I pray that this actually will improve your skin outcome. Please share your results with us. We want to know, and we want to share your testimonial videos with the rest of the world to motivate them and see that nature does win. That is why we changed the name of our products from Ardis Labs to Nature Wins, because we believe God and his mother nature he created in his pharmacy is the ultimate divine healing elements. I'm Dr. Ardis. This is Dr. Ardis Show. This is Psoriasis, and we will see you next time. God bless.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor, patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.